I'm going to go ahead and record the webinar here, so just letting you guys know. This webinar is called EHR Replacement. What do I need to know? As I mentioned, I'm going to leave you guys unmuted. So if you do have questions along the way here, I invite you to ask those questions. And so I guess my assumption here is that people are joining the call because they're considering doing an EHR replacement, or you have already replaced your EHR and maybe need to consider what you need to do with the old data. So what I'm going to talk about today, I'm going to tell you just briefly about who I am and our company, eFormatics. I'm going to talk about what are the drivers behind EHR replacement. There's been a lot of people switching, and I want to talk about why, for the most part, that is. Go over some main concerns that we hear about EHR replacement, and talk about some additional items that you may not have considered when doing an EHR replacement. And then go over the top 5 reasons why these conversions often fail, and talk about what you can do to prevent that. Also going to give you the options for a legacy EHR conversion. This is in regards to the data. What are your options for retaining that data and making sure it's accessible after you do your conversion? And then I'm going to go back and circle back to the concerns that we talk about in the beginning here and address each one of those concerns. So about us, our company is called eFormatics. We are a healthcare IT consulting company that specializes in EHR data migrations. We've worked with hundreds of different healthcare organizations. We've been in business for almost 9 years now. We serve small physician practices to large 500-plus provider groups and hospitals. And this is really the majority of what we do, is we develop and implement EHR conversion strategies for healthcare organizations of various sizes. As I mentioned, the EHR data conversion is probably 90% of what we do. We also have a product that allows for legacy data archival, and then we also have built several applications that can be bolted onto various EHRs. And I am the CEO of the company. My name is Benson. So I've been, this is a company that I had started 9 years ago, and I've been doing that since. So I'm very, very knowledgeable about the whole process and what's involved with an EHR data conversion. Why are people switching EHRs right now? We know that out of a Black Book rankings survey that physicians seeking a replacement has grown from 30% in 2011 to 50% in 2012. And they were calling 2013 the year of the EHR switch. So the main reasons they found that people were looking to switch really all revolved around the EHR not meeting the needs of the practice. So if you look at here, the top 4 reasons are really all around dissatisfaction with their EHR. Obviously there are cases where there's acquisitions, where data needs to be migrated, from one system to another. But the primary driver behind the EHR, people switching EHRs, really has to do with dissatisfaction. I'm going to pause really quick here, and if you just hopped on, I wanted to mention that I'm not muting everybody. I want to allow for you guys a chance to ask questions along the way. So if you don't have a question, if you could put your phone on mute, I'd greatly appreciate it. Does this with you guys is this the primary reason that a lot of you are potentially considering switching EHRs? Is it really dissatisfaction? Or both?
Action and cost and the cumbersomeness of upgrades and that sort of thing.
Gotcha. Okay. So yeah, let me go on to the next one. So a lot of the common questions that you hear people asking about, whether I can move, from one EHR to another. There's a lot of questions around the data, and questions like, can all of my data be brought over to the new EHR, or is some of this data going to be lost? What's it going to cost me to migrate this data completely over to my new EHR? How can I guarantee that the data is going to come over appropriately and it's going to end up in the appropriate place within the new EHR? And then, what's going to happen to my old system? Am I going to have to, if I can't get everything over, am I going to have to leave that old system up and running indefinitely? Or am I going to be able to migrate everything and then turn that old system off? And before I keep going here, does anybody have any other primary concerns that they'd like me to potentially address in this webinar? Or do people feel that covers the majority of the concerns there? Okay.
Well, actually, I do have a question. How
Sure.
does the conversion work with regards to meaningful use? Because so many times when we're doing meaningful use, we're getting credit by, clicking or doing specific things in the system with e-prescribing, and the CPOE, all of those types of functionalities. So if we convert mid-year, how do we get credit for that first part of the year?
So in terms of whatever the requirements there are, obviously you'll have to be able to report in, wherever your data resides, if that's what you're asking. Is that kind of what you're asking there?
Well, no, what I was asking is if we don't leave the old EHR up and running and we bring in our data, how are you going to capture that we gave patients, PIFs, that we did the e-prescribing, the computer order entry by a physician, all of those meaningful use measures that we have to be able to report on?
Yeah.
How do you capture that?
Obviously, all that information, or all the data that holds that information would have to be moved somewhere, right? So if you're going to report on that information, you have to have that data in a place where you can query it, and pull that data. So whether you end up leaving your old EHR on and up and running, you put that data into a different location, potentially an archive that where you can report that information, or whether you move it into your target EHR. Does that address?
Yes, thank you.
Okay. Yep. Okay. So it's something that's a great question, and it's something that you have to consider, right? So there's a lot of things to consider with these conversions, and that's one thing, that the strategy that you come up with for your migration has to take these types of things into consideration. So that's a great question. So some additional items to consider is the patient, the full legal record of the chart there. So state requirements are that you have to keep the legal record around for anywhere from 7 to 21 years. So you have to have a strategy behind maintaining that legal record as part of your solution. Continuity of care. You want to make sure that the patient information that the physicians need to be accessing is easily accessible for them. Whether it is an archive solution or whether you bring the data over discreetly into the target EHR, you got to make sure they can get to that information easily. Appropriate planning. A lot of times we've worked with organizations who come to us kind of late in the game, where they've decided to migrate to a new EHR, but how their legacy data is going to be handled is sometimes an afterthought. So you want to make sure to think about your data conversion strategy and put your plan in place up front in the migration process there. There's going to be a few different parties involved. So you're going to have decisions that you're going to have to make as an organization around your migration. You're going to have an organization such as ours, who's who is planning the migration and coordinating everything, and you may even need a little bit of assistance from your current vendor, EHR vendor that you're on. Not always, but there is a possibility for that. And then you really want to make sure that that you have the appropriate level of expertise to do these conversions. Oftentimes we work with organizations who may try to do it themselves at first to do the migration, and that almost never works out. It is a complex process, and so we really emphasize making sure that you have the appropriate level of expertise, people who know all of these options and do this stuff every day. So, and that's really how you can ensure a successful conversion, is working with experts. So something that we, a conversation that we often have with our customers is they'll call us and say, I really want to migrate from my current EMR, but I've been told that conversions just don't work. So some of the things that I'd like to speak to for that is that the main reasons we have found that EHR conversions end up failing. The number one reason we find is that people don't know the right questions to ask about an EMR migration. So, for example, a couple questions I have here is my drug interaction checking going to continue to occur on my legacy data? And am I going to continue to receive the allergy alerts on my legacy data in my new EMR? Evaluating how compatible the two EHRs are for a data migration. How similar are the EHRs? How are the coding systems similar? Are they very different? And is there going to be a lot of mapping effort involved? So really, folks who haven't been through the process don't even really know the right questions to ask, and oftentimes that can lead to an unsuccessful conversion. Having an assessment performed where you're really evaluating what are the what is the requirements for my data migration here? What is the feasibility here? What is the appropriate solution before oftentimes people kind of look at data migration as well. You're just pulling data out of one system and shoving it into another. It's really not like that at all. There's a lot of decisions to be made along the way, and there's a lot of choices that you have in terms of what you want to do with your data. Lack of a bulletproof testing process. The testing process for migration is really collaborative between whoever is performing your migration and the organization themselves. Making sure that you do have some clinical staff who is involved, who's looking at the data and sees how is the data going to be presented in the EHR that you're moving to. So that there's no surprises when they pull up the data in the new EHR for the first time. They know exactly how it's going to look in there. And then, as I already mentioned, data conversion being an afterthought, where it's brought up too late in the game to be able to do it as successfully as it could be done. So I'm going to briefly talk through. I have 6 options listed here for EHR conversion. I'm just going to briefly go through those and talk about the pluses and minuses of each of those. So one, option that you have there is really just to leave that old EHR up and running. But there's a big downside to that. For one, you could end up paying ongoing maintenance and support costs, which could be extremely large. And so you're also requiring your physicians to log into another system to look for the data that they need for that particular patient. So it's definitely not recommended to go that particular route, but some folks do it if they don't have, they are unwilling to dedicate funds or resources for a conversion. Number 2 is manual entry, which is exactly like you'd think it would be. Basically, just hand typing things in from the target or your old EHR into the new one. The benefit of that is, yes, the data is moving over to the target system, your new EMR there. but it's going to take you a very long time to do that, and in some cases it can be years of manual entry. The third option here is discrete data conversion, and this is where you're actually electronically transferring your data out of your old EHR and into your new EHR. Huge benefits for this. One, that full EHR functionality I talked about in terms of allergy alerts and drug interaction checking is going to occur on all of your data, and it's right there. So all the data from your current EHR is going to exist in your new EHR, so they don't have to log out to another system to look at that data. The downside to trying to do a full discrete conversion is it can be cost prohibitive for smaller practices. As I mentioned, it's a pretty complex process, and it can get expensive depending upon the extent to which you take it. And the other downside there is it definitely requires conversion expertise. It's not usually something organizations are able to do on their own. Summary document. This is kind of a simpler way to just put the data from your current EHR into a PDF. I would also call CCD migration if you're going to do it as a document. I would lump that in the summary report documents. The pros to that is it's usually much more cost effective than a discrete conversion. However, typically you could be dealing with very large documents, and so you want to make sure that data is easily accessible, and sometimes if it's buried in a 20-page document, the physicians aren't going to be very happy about that and not be able to use their data and provide the appropriate level of care to the patients. So another option here is legacy EHR data archive, and this is essentially taking your data within your source system there, your current EHR system, and putting it into an archive, which is typically accessible from an EHR. So most EHRs that are out there allow for the capability to link out to archives from within their EHR. So this is an excellent solution in that it really is the most cost-effective conversion solution. You're essentially taking that data from the old EHR and putting it into the archive. You're not having to do any mappings or worry about coding system differences or anything like that. So in terms of effort there, it's fairly minimal. And it also allows ease of access, so you don't have to, if you can access it from your new EHR, you can just click the link or the tab within your new EHR and it'll pull up all of the legacy information for that particular patient without having to log in to another system and search it. One of the downsides to that is that the full EHR functionality that I mentioned would not be available. So you wouldn't have the ability to, the allergy alerts and the drug interaction checking would not be enabled on your legacy data if you did a full legacy data archive as your solution. I'm going to talk about that in just a second here. So the last option that I want to present is a hybrid conversion. So what's really nice about a hybrid conversion is you're able to kind of take the best aspects of all of the different options there and apply it to your particular situation and figure out what makes the most sense for you as an organization. So as part of the assessment phase, typically what needs to happen is each clinical data module is going to be evaluated individually to figure out what's the compatibility of that particular module. Is the coding system the same between medications in System A and medications in System B? Is there a lot of free text data there? To figure out if you're going to be able to bring it over discretely or if maybe an archive solution for that particular data module makes more sense. So a typical example of this would be a conversion in which allergies and medications and problems are brought over discretely into the target EMR system. Maybe just a summary document is generated out of the current EHR and brought over as a document into the new EHR. And then putting scanned images and office notes or immunizations or vitals or results into the legacy EHR data archive. And as I mentioned, we've been doing this for about 9 years now, and this is really by far the most common choice that organizations go with because of the flexibility that is allowed through this. And it allows them to sort of customize their conversion based on their requirements and based on their timeline and based on their budget for an EHR conversion. So going back to what we started with in terms of some of the common questions that people have, can all of my data be brought into the new EHR? So in some way, yes, it all can. It doesn't mean that all of it's going to end up discretely within the target EHR, but you can do something with all of your data there, whether it's a combination of the options there. You are able to bring all of your data over. Is some of my EHR data going to be lost? No, it doesn't have to be. Basically, the testing, through testing and validation of ensuring that your data has come over successfully, most of the EHR archives that are out there can take any data that's within your target system. Your EHR system there. So that data is not going to be lost. It's going to be brought over so that you can retain your full legal record. How much will it cost to convert it? So this is obviously going to depend upon which options you go with. As I mentioned, there's more effort in discrete than doing a legacy EHR conversion. So really the options that you choose there and the scope of your conversion is really what's going to drive the cost. How can I guarantee that the data will come over appropriately into the new EHR? So this is really the testing there, where you're going through and creating test cases for all of the different potential scenarios that you may encounter for a conversion, and making sure that all your test cases pass prior to go live there, and also that your physicians have taken a look at the data as it's going to show up in the target EHR. And ensure that or confirm that they're seeing the data as they expect to see it, and performing a chart-to-chart comparison between the old EHR and the new EHR. Will I need to leave my old EHR up and running indefinitely? So the answer to that is no. You do not have to do that. In some cases, if you were to just pull over, let's say, some of the modules discreetly, and you were going to leave your old EHR up and running, that's one way to go. But as I mentioned, there's usually typically some pretty hefty support and maintenance costs associated with that. So typically, you're much better off putting that old data from your old EHR into an archived solution. So I'm going to open it up to questions here. I know it was a kind of a short webinar. I wanted to make sure we had plenty of time here to talk about any questions that you guys might have. Anybody?
No, I think we're good right now.
Okay. Well, as I mentioned, we will send you guys out. I did record this webinar here, and we will be sending out the slides here. If you'd like us to take a look, or if you'd like to reach out to us and here, you know, on a one-on-one meeting with you guys. We can set up a meeting if you're considering changing EHRs. You have some more specific questions you want to go over with us. Just send an email back to us, reply to our email here, or just shoot an email to brad.benson@healthyformatics.com, and we will set up a meeting with you. So thank you everybody for joining, and hope to hear from you soon.
Thank you.
Thank you.
Bye bye.